We all believe that speeding up digital transformation across the NHS is really important. What do you think the challenges are that are holding up this process across the NHS at the moment?
Well, I think one of the biggest problems is to make sure that we can bring people with us. Ultimately, the technology is the easy bit. The hard bit is the culture change that comes with it, and the need to bring people with us. That both clinicians, management, all parts of any organisation. I think that's nearly always the hardest bit. Partly that's because in the rest of our lives, upgrading the technology has become something that we don't really notice, because as tech becomes more agile, better reflecting users' needs, you don't really notice when you update your iPhone or whatever it is. But often a change in technology in a hospital is like it used to be 10, 20 years ago, when you then have to relearn a load of things, and it sucks time. And we need to change that so that the technology better meets people's needs.
How can we ensure that there's sufficient investment in digital transformation?
Well, this is really important. There's, of course, pots of money which we in the department hold and will allocate to good projects, and that's obviously I recognise that's an important part of it. But I don't regard that as the most important technology spend. The funding that we allocate, and in future will be allocated through NHSX, is less important than the investment that each NHS institution, each trust, invests in its own technology. Owning the technology at a board level, at a chief executive level, is critical to getting this right. And you don't need to understand the technology or be able to code in order to do that. You need to care about improving patient quality of service by using the best technology, and therefore allocating budget towards it. And ultimately, a huge amount of this technology can save money. I want to make it as easy as possible to see future savings and bring them in to allocate money this year. And I hope that with our 5-year settlement from next year, there'll be more of that fluidity to be able to spend money that will save over a period. But ultimately, the most important spending on technology is what's done within a trust on their own budget to improve the technology for their people.
And how should we make the case for more investment in the spending review?
We'll make the case through outcomes and improved performance. And that's the argument that we need to make. So you can do this in 2 different languages. The language of giving more time to clinicians and giving more better outcomes for patients. That's the language that we should be using to the clinicians and the patients. The language to Treasury is, we can make your money go further if we make investment in this space.
It can be a real concern for both clinicians and patients that technology creates barriers rather than brings them together. How can you reassure people that this won't be the case?
Well, we can only reassure patients that technology improves their relationship with their clinicians by making that so. The truth here is that you've got to get the technology to work for the users. You can't gild the lily. You can't pretend that it does if it doesn't. If you need 30 logins, no wonder people are frustrated with the technology. If it takes you 10 minutes to log on when you're busy or you have a sick patient in front of you, of course people are furious. These are the things that we need to fix.
How can we quickly address the huge variation in digital preparedness that exists both across communities and across the country?
Well, I want to see a rapid take-up within the NHS. I want to see CIOs or CCIOs on board so that every NHS organisation sees technology as absolutely core to how it runs the organisation. We then need to make sure also that patients who want to use technology can, but we need to recognise that not everybody's able to. And I suppose whether that's because they don't want to, or whether their broadband isn't good enough, in a way, the reason that people can't use the technology is less important than the fact that the use of technology needs to free up time and resources for people who can't use it. And that's the approach that we need to take. In a way, my focus is on making sure that absolutely at its core, the technological changes we make, the changes to the technology, the mandated improved standards of interoperability and cybersecurity and data protection, which are vital, and the better technology, especially in hospitals and across primary and community care. The thing I really, really want to see out of that is to be clinicians given back time so that they can do the things that only they can do. And that has to be at the core of it, because ultimately I care about technology because I care about people and people getting a better service from the NHS.